This is task number 20, so we're going to go ahead and collect some urine for a urinalysis. Come on, Sadie. So we have at least our 2 cc's or 2 milliliters of urine. So we're going to go ahead and pause our video and go in and take the next step. Okay, so we're back. So we're going to go ahead. We have our sheets we can write our urinalysis results on. So we are going to put our patient's name. Okay. And then we're going to go ahead and take a look at our urine. And it is clear, yellow. There was no foam seen on it. Okay, so now we're going to go ahead spin down our urine. So we're going to use our pipette to transfer it in. Place it in with a stabilizer. Good stuff. Okay, so we're going to close our lid. We have it already set on the urine sediment, so we're going to go ahead and start spinning that down. Okay, and then we're going to go ahead. We're going to check our specific gravity. We're just going to get a drop of urine, place it on there, gently close our lid. We're going to go ahead and take a look. You always want to point it at the light so that you can read it. So our measurement is 1.030. So go ahead and put our specific gravity on as 1.030. Go ahead and place our urine on our stick here. You just want to make sure that you completely cover them. And then, depending on which one you're looking at, like, it can take 30 seconds to 120, and it tells us on the side of our bottle which ones take a specific amount of time. So we can go ahead and remove our spun down sample. So then we're going to go ahead and start comparing, and as you can see at the very bottom we have our ID band to show us where to start. So our glucose hasn't really changed a whole lot, so we're going to go ahead and move to our next one. So our bilirubin is going to be negative. And then we're going to look at the ketones, which is negative as well. Okay. And our specific gravity on here is actually going to be 1.030 as well, which we've already noted from our refractometer. It's going to take a look at the blood. There's no blood, so we're going to mark that as negative as well. Then our protein, we have just a trace amount, so we're going to mark just a trace. Okay, so then our next one is our urobilinogen. And that one is going to be normal. And according to that, it's like 3.2, so we're going to write that beside it. Our nitrates are negative, and so are our Okay, so it doesn't have that on there, so we're going to go ahead and just note it on the bottom. And then our glucose is also negative as well. So now what we're going to do is we're going to take our sample and we're going to come over to the microscope. We're going to get our SETI stain out. And we just want to drain off the very top and just leaving a little bit of urine and the settlement in the bottom. We just want to add 1 drop of stain. And we're just going to kind of flick the bottom of our container to mix it up real well. Okay. And then we're going to take our pipette and we just want to pull up 1 drop and place it onto our slide. Then we're going to put a cover slip over top of that. Place it on our microscope with the frosted edge to the left. And we're going to start on one side. And make sure we're all zoomed in and that we can see everything. And so this is trying to locate any crystals or cast or blood cells that we may find in the urine. Okay. So once we are all focused in, we just want to go ahead and slowly move across our slide, and we're just going to take note of any crystals, blood cells, platelets, cast, anything like that that we see. And so far everything is looking really good. We're not seeing anything abnormal. Sometimes it is normal just to find certain crystals, but as long as they're not in high numbers, there's nothing to be concerned with. Okay, so everything actually looks really good on this urinalysis. We'll go ahead and let the doctor know. Okay, so we'll go ahead and shut that off. And then we're going to go ahead and just close up our stuff here. And we're going to mark that we didn't see any red blood cells or crystals. Okay, or white blood cells, no casts. So then we're going to go ahead and come over to the system here, and we have actually pulled up a few samples for you to see. So these here are crystals. The most common one that we see are the struvite crystals. Crystals are basically formed from a buildup, possibly the diet that the patient is eating. And then our next one are casts that you could see. Some, like this one here, is hyaline with fat, hyaline with fine granular, coarse granular, waxy. The cast you normally see if a patient is suffering with kidney disease. And then some of the different cells that we see on our slides are the white blood cell, which you can see here, red blood cells, and then we can also see platelets here. These here you normally see if a patient has a urinary tract infection. And so normally when we run our information in our machine that we have, it automatically moves the results over. So we will take this and go in and put them into the patient's chart before we leave for the day and let the doctor know what exactly we've seen. And that's the end of task 20.